Welcome to the first sketch covering anti-epileptic drug therapy. Epilepsy is a chronic disorder characterized by recurrent seizures, episodes of brain dysfunction caused by the abnormal discharge of cerebral neurons. Seizures can have many causes including infection, neoplasm, trauma, or heredity. But the important thing to remember on the exam is that not all seizures are the same. And picking up on key facts in the medical history will clue you into which anti-epileptic to choose. In order to illustrate these varying seizure types, we're going to go back, way back, to a time when seizure and seizing was just a way of life. Yeah, I'm talking about the Age of Discovery, a time when Spanish conquistadors sailed beyond Europe to seize territory in the New World. The year is 1530, and Francisco Pizarro sets sail with the blessing of the Spanish king to conquer the Incan Empire. This is his third expedition to Peru, actually, and while the first two were hindered by unexpected violence from the coastal natives, this time he is determined to make landfall. Now, the drugs we will discover among the riches guarded by the Incas are going to be our broad-spectrum anti-epileptic drugs. This means that these drugs will be effective for almost any seizure type, including focal and generalized seizures. During a focal seizure, the attack begins in a specific locus in the brain and typically affects only one part of the body. Focal seizures are represented here by this Peruvian native dodging one of the cannonballs fired by Pizarro's men and losing his balance. Notice that he is shaking a single arm to catch his balance, a focal shaking for focal seizures. Now, there are different types of focal seizures. In simple focal seizures, there is no loss of consciousness, and the seizure presents as a clonic jerking of an extremity or other sensory, autonomic, or psychic symptom. In complex focal seizures, there is a loss of consciousness, and it's often associated with automatism such as lip smacking or swallowing. Luckily, though, from a pharmacological perspective, the drugs used for partial seizures are more or less the same for all subtypes of partial seizure. So we're not going to be differentiating them here. Generalized seizures will be represented by the other Inca on the watchtower. Notice that his entire body is shaking as he tumbles from the crumbling wall below. Generalized seizures involve both hemispheres at onset. The most common type is the generalized tonic-clonic or grand mal seizure, characterized by diffuse muscle contraction followed by rhythmic jerking and most likely a post-ictal state. Remember, too, that partial seizures can become secondarily generalized and turn into tonic-clonic seizure. Pharmacologically, most drugs used to control partial seizures can also be used to control these generalized tonic-clonic seizures. There are many more types of generalized seizures, but don't worry though, these broad-spectrum anti-epileptic agents have got most of them covered. So let's say you're on your neuro rotation and a 13-year-old boy presents to you with a history of sudden jerking movements in both arms. He gets more of these episodes when he doesn't get enough sleep, and his parents reassure you that he does not lose consciousness during these episodes. That sure sounds like a general seizure because both his arms are involved. That's definitely two hemispheres. But it's not your typical tonic-clonic. This sounds more like a case of juvenile myoclonic epilepsy, another form of generalized seizure that can be successfully treated by these broad-spectrum drugs. Juvenile myoclonic epilepsy, or JME, will be represented here by this Incan juvenile as he flaps both his arms chicken style at the encroaching Spanish. In addition to JME, many of these broad-spectrum anti-epileptic drugs will have some effect on absence seizures as well. These generalized seizures will be covered in the third anti-epileptic video, so stay tuned. Also, be sure to check out the next video for more info on the older narrow-spectrum anti-epileptic agents. While they may be useful for partial seizures and generalized tonic-clonic, they're often ineffective and may even exacerbate the other types of generalized seizures I just mentioned, including JME and absence. And what do you know? It looks like this time Pizarro and his Spanish soldiers have convinced the Incas to allow them entry. And they even get to meet the great Inca Emperor Atahualpa himself. Let this welcome festival procession represent our first broad-spectrum anti-epileptic, valproate. This drug is effective for all the seizure types discussed previously. So even when your patient comes in with one of those juvenile generalized seizure disorders, valproate is one of your go-to agents. Valproate works by binding voltage-gated sodium channels, thereby preventing the sustained high-frequency firing of neurons. This binding extends the inactivated phase of these channels, kind of like these beautifully woven baskets filled with salty sodium peanuts. A peace offering for the Spanish visitors. An open basket is kind of like an open or activated sodium channel. Shortly after depolarization, an activation gate swings shut, only resetting after the neuron is repolarized. That inactivation gate, then, is kind of like the lids on these salty sodium peanut baskets, holding them shut. You know, maybe Pizarro will be a huge fan of these salty Incan peanuts and forget about the whole guns, germs, and steel thing. And then he'll be on his way, right? Right, guys? Like most other anti-epileptic agents, valproate affects many other channels, receptors, and neurotransmitters. Specifically, valproate may increase the levels of GABA, an inhibitory neurotransmitter in the CNS, either by increasing production or decreasing degradation. These elevated GABA levels will be portrayed by the taxicab design of the Emperor's elevated transportation device. Recall that we've seen this cab design before in the sedative hypnotics chapter, where we illustrated how each of those drugs has a direct effect on the GABA-A receptor. The most common side effect of valproate therapy is GI distress, including nausea and vomiting. This is depicted here by Emperor Atahualpa as he experiences some GI distress induced by his travels over the bumpy Incan terrain, or perhaps it's one of those horrific diseases that Pizarro brought as his own special welcome gift. Oh, Pizarro, you didn't have to. Valproate can also cause increased appetite and weight gain, represented here by the massive girth of the Emperor. Years of sitting in a palanquin will do that to a man. At higher drug levels, valproate can cause a fine tremor, which is represented here by the most skeptical Incan man as he holds up a trembling weapon, waiting for Pizarro's next move. Another side effect of valproate therapy is rare but possibly fatal hepatotoxicity. Careful monitoring of liver function is therefore recommended when starting the drug. Take a close look at that prized cow the Incas have brought along, and you'll see our recurring sketchy symbol for hepatotoxicity, that hepatotoxic liver spot. It's a nice cow for sure, but I think Pizarro has his eye on something else. Gold. All the stories of the great wealth of the Incan Empire surely must be true. Little known fact, the Incas polished their gold with sponges to keep it nice and shiny. So let this squeezed pancreas-shaped sponge represent acute pancreatitis, another possible side effect of valproate therapy. Valproate has also been associated with major fetal malformations. As always, whenever we want to remind you of teratogenicity, we'll sketch in that teratogenic tarantula, this time incorporated into the Incan shields carried by the welcome procession. If valproate is taken during pregnancy, the baby has a much higher risk of suffering from neural tube defects, including spina bifida. Just think of this celebrating Incan mother here wearing that cerebral hat and getting funky with those Incan tubes. And here he is, the conquistador Francisco Pizarro, presenting himself to the emperor. Oh. Pizarro lifts his helmet in a customary greeting, but his toupee stays inside his helmet, revealing that shiny Spanish scalp of his. Yeah, that toupee represents the broad-spectrum anti-epileptic drug topiramate. This drug is effective against many of the seizure types we discussed previously: focal, generalized, juvenile myoclonic, and possibly even absence, though it's not as effective as valproate or lamotrigine. Like valproate, topiramate works by increasing the inactivation of sodium channels, blocking the sustained high-frequency firing of neurons. And again, we've included those inactivated baskets of salty sodium peanuts. He feigns gratitude, of course, but I think he's salivating over something a bit more deliciously golden? Like valproate, topiramate also potentiates the inhibitory effects of GABA, but this time by directly binding to an allosteric site on the GABA-A receptor. Just think of Pizarro here directly binding to one of the Incan cab drivers in a friendly, Spanish flu-ridden handshake. The side effects of topiramate will be represented by the ragtag band of soldiers and sailors that follow Pizarro into the strange land of the Incas. I mean, just look at these two soldiers here. Not looking too hot after months of sea travel. They perfectly represent the common dose-related adverse effects of somnolence and fatigue. I don't think this soldier here even remembers what year it is, and as he scratches his head in confusion, let it remind you of the confusion and cognitive slowing caused by topiramate. Yeah, to join Pizarro's crew, you really didn't need intelligence. As long as you like shiny things, you were in. Ugh! How long were they out there sailing for? That guy is looking gaunt. Forget about the Incan gold. Can a man get an Incan sandwich around here? It just goes to show that weight loss is another common dose-related side effect. Patients can expect to lose a few kilograms during their first year of therapy, and this effect likely stabilizes after 2 to 3 years of taking the medication. Another possible side effect of topiramate therapy is urolithiasis, as represented by the kidney-shaped wheel of this friendly cannon and the kidney stone-evoking cannonball strewn about. They're going to use that for, like, celebratory fireworks or something. Right, guys? Then they'll leave? Right? And lastly, topiramate has been associated with acute myopia and angle closure glaucoma. If this reaction is suspected, the drug must be stopped immediately. Acute angle closure glaucoma is represented here by Pizarro's assistant as he acutely closes the angle on this high-pressure tea kettle, which looks strangely like an injected glaucomatous eyeball. In the back of the procession, the village elder mournfully watches as his people march to their doom. His stately llama, the noblest of Peruvian creatures, represents the next broad-spectrum anti-epileptic drug, lamotrigine. Lamotrigine is effective against many of the seizure types mentioned above, including, as we'll see later in the chapter, absence. Like both valproate and topiramate, lamotrigine works by increasing the inactivation of sodium channels, thereby blocking the sustained high-frequency firing of neurons. And for the last time, we see the inactivated baskets of salty sodium peanuts at the llama's feet, as he takes this opportunity to grab a quick bite. The major adverse event to look out for? Skin rash. 10% of patients taking lamotrigine will experience a benign skin rash. However, around 1% of patients, particularly children, will develop life-threatening Stevens-Johnson syndrome or toxic epidermal necrolysis. SJS is represented by our recurring sketchy symbol, an easily sloughed-off red mask, this time worn by the elder to hide his disdain for the Spanish and his grief for his people. So many feels behind that tengu. On a lighter note, lamotrigine may also cause other CNS effects, including diplopia, which is represented by the llama's crossed eyes. And at least on a llama, that's kind of cute, right? Okay, the last broad-spectrum anti-epileptic drug we'll encounter in the land of the Incas is levetiracetam, represented here by this elevator used in the construction of what was supposed to be their grandest temple. Levetiracetam is effective against many seizure types, including those pesky juvenile seizure disorders, although it's not used as much to treat absence. The major side effect of levetiracetam therapy is somnolence, which is represented here by this drowsy elevator operator who fell asleep at the wheel. Alright, the last thing to mention before we wrap up this revisionist historical drama, cytochrome P450. Many anti-epileptic agents, both broad and narrow spectrum, are metabolized by the cytochrome P450 system in the liver. Our recurring symbol for cytochrome metabolism is a CYP450 license plate attached to a chrome bumper. And in this scene, if you look carefully for the origin of that cannon fire, it's incorporated into the side of Pizarro's ship as he launches a preemptive strike against the Incas. So be careful when co-administering agents that alter CYP450 enzyme activity, because you might be affecting the serum concentration of your patient's anti-seizure medication. So remember, valproate, topiramate, and lamotrigine are your broad-spectrum anti-seizure medications used for all types of seizures, including focal with secondary generalization, and a whole load of generalized seizures. In our next sketch, we're going to cover the narrow-spectrum anti-epileptic agents. While useful for generalized tonic-clonic seizures, they should be avoided in the other generalized seizure disorders, including juvenile myoclonic epilepsy. In fact, they can actually exacerbate seizures in these patients. Oh, and we're also going to travel back in time, believe me. But instead of the 1500s, we're going to go back to the future of 1955.